You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
We are committed to the pharmacy owner's success. PrimeRx believes in empowering pharmacies with innovative solutions to thrive in today's competitive landscape. We look forward to working with pharmacy owners and sharing how our solutions can contribute to their sustained profitability and growth. Connect with us on the web by going to PrimeRx.io. That's PrimeRx.io.
Hey, this is a feature episode of the Pharmacy Podcast Tech Trends from our team and trusted technologists on the Pharmacy Podcast Network, PrimeRx. You can learn all about them at PrimeRx.io. And I'm excited today because we're shifting gears from technology, which we really dive into most with the Tech Trends podcast, and we're moving into PBM reform. And I always think, how are the collective, how are our wholesalers, how are our state organizations, and our physician collaborations, and of course, our politicians and our political leaders, how are we coming together to get more support around PBM reform, but also reaching back out to these people who spend their lives serving their constituents in their districts? I want to welcome a special episode with Senator Vin Gopal out of the great state of New Jersey. He's the Majority Whip for District 11. Gopal, this is a very special episode. We appreciate you being here.
Thank you so much for having me and to talk about this very important topic. I appreciate it.
Absolutely. While we were in the green room, as we say in podcasting, we were, before we started recording, we were talking about coming together and reaching across the aisle and really working to do something that's going to impact, in your case, the state of New Jersey and your people that are in the state, in your district. But everything that you do and everything that another state senator does has this ripple effect of this surge of energy that's getting more attention from the public, and of course educating our legislators as to what PBM reform is going to do to the entire healthcare system, which is on kind of on edge right now, you could say. But give our listeners a little background on yourself and what you're passionate about when it does come into the pharmacy benefit manager and the reform that we need.
Sure. So I've always been a big believer in small business over corporations. I really feel that corporations are taking over our country in a really dangerous and unhealthy way. And I think both parties have been really to blame for that over the last several decades. We're watching it in every aspect of life, where we used to have many independent physician practices, and now we're seeing hospitals really take over and buying real estate. We're seeing more and more chain stores. An unintended consequence of when the Democratic majority passed a $15 minimum wage is that many bigger companies, for example, I had someone who owned 11 restaurants, was able to absorb the cost, but the individual that had one little coffee shop went out of business very quickly. So these one-size-fits-all policies are not great. So I have tried to focus in my 8 years as a state senator to try to look out for small businesses and to look out for our main streets and not so much our corporations that many who continue to make record profits, whether they're in the insurance industry or other areas. And we see that in no other place than with pharmacy benefit managers and how they impact independent pharmacies. Independent pharmacies continue to go out of business at an alarming rate. And there is a moral inadequacy in the sense that PBMs can have a direct business relationship with their pharmacy. So for CVS Caremark to have a business relationship with their chain of pharmacies where they could essentially steer business away is wrong. And I think that this is now, over the last 4 or 5 years, this has become a bipartisan issue. President Trump has recently spoke out for the need for PBM reform. We saw the governor of Arkansas, Governor Huckabee, a very MAGA Republican who has signed some significant piece of legislation in Arkansas saying that PBMs cannot have a business interest with their pharmacy. And here I am as the Democratic majority whip in New Jersey, sharing that same sentiment. So I think there is a lot that we can do. It's not just about protecting independent pharmacy owners and small business owners, but it's also protecting our consumers. It's about protecting how much people pay for their medication, and to make sure that there is somebody at the other end of that counter who has empathy and is part of that community and understands and can give that senior that advice they may need that they're just not going to get in a corporate environment. PBMs are essentially, by definition, a middleman. They're not creating any medication. I've talked to multiple folks in the pharmaceutical world here in New Jersey, and they tell me how much PBMs are the problem. They are the middleman here. You don't need a middleman they're not doing anything really to create the medication or invest in it. So I think that this is long overdue. And now I'm happy to see we're taking steps in New Jersey that are similar steps across the country on PBM reform.
Senator, please share with our listeners a little bit about what you are working on and maybe some of the specifics about how those policies will help to even the playing field for privately owned pharmacies versus our chains, versus hospital system, versus 340B. And the ripple effect of that is immense. And, we at the Pharmacy Podcast Network, we are not anti big bucks pharmacy. We're anti insurance providers getting in the way, standing between a physician, a pharmacist, and the patient because they're using a prior authorization as a mechanism to change the way that they're going to get paid, how much they're going to get paid, and which pharmacy the patient has to go to. It's artificial. You start inserting insurance into literal healthcare, and it becomes artificial. And like you said, one Band-Aid does not fit all wounds, and we got to get out of the way. So open up and let us know what's your state.
Sure. So I think to your point, for all your listeners, for those that don't know, but pharmacy benefit managers are third-party administrators. There's three really large ones in our country: CVS Caremark, Express Scripts, which is owned by Cigna, and Optimum Rx, which is owned by United Healthcare. There are a number of other PBMs, but those three PBMs control relatively 80% of all of the prescription drug market. And a big issue in that is really spread pricing, clawbacks, and opaque rebates on how they've eroded trust. I'll give you an example of what spread pricing is for your listeners that are not fully aware. A PBM may pay a pharmacy $10 for a drug, but may charge the plan sponsor $50 for the same drug, resulting in a $40 spread that the PBM retains. So they're basically like a reseller of some sorts, except they're setting all of the ground rules, and they're setting all the contracts. The PBMs say they're trying to protect pharmacies. So the original idea of why a PBM started spread pricing would be to guarantee that the pharmacy gets a price. And if they could not negotiate to acquire the drug for that price, then the PBM would pay the difference. But in reality, the lack of transparency around the cost of these drugs have allowed PBMs to take advantage of a lack of transparency. PBMs argue, well, it's private information. Nobody should know what it is. That's just not the case. It's not. This is not a confidential healthcare information. This is not a business strategy. That pricing should be public. Everybody should know what the cost of a drug medication is. So I think because the system is so fundamentally broken, these practices have led the drug market to make sure less medications are out and to make sure more expensive ones are out there. A House committee report found 300 examples of 3 PBM preferred medications that cost at least $500 more per claim than a safe alternative medication excluded from their formula. So we're doing a lot here in New Jersey. Some of the laws that we have successfully got signed into law, S2841, which took 18 months to after enactment. It just got enacted. It requires PBMs to be licensed through the Department of Banking and Insurance. And the goal of that is to stop spread pricing, where PBMs say they can save money, and requires the savings to be secured using lower premiums and out-of-pocket costs for consumers. So that legislation that was signed into law on July 10th of 2023 just took effect January of 2025. Unfortunately, still having some challenges getting up, but it will enact critical protections once it's fully up and running, and will require more oversights and create a government agency in the Department of Banking and Insurance to see is money being saved, and or are these guys just making record massive profits at the expense of not just small businesses, but at the expense of patients. We also have S3538, which is hopefully going to be heard shortly. It's establishing the Equitable Drug Pricing and Patient Access Act, and that would ensure reimbursement rates to pharmacies are transparent, equitable, and reflect the actual cost of pharmacies. Reimbursement rates would be based on a national average of drug acquisition cost plus a standardized professional dispensing fee, which we put in at, which I believe at a very low rate of $10.92, but that's, we're trying to be fair. I think an independent pharmacist's time is more valuable than that, but we're trying to understand that they're also going to make some money on the medication too. We also have a bill that we're pending right now, which is going to mirror that Arkansas bill I talked about, which is going to prohibit pharmacy benefit managers from owning or operating pharmacies. Arkansas did it. Governor Huckabee signed into law. We want to follow suit there. Other great bills have been passed in Massachusetts and Mississippi, but that's just a little bit of where we are. And there's trends happening now of great PBM reform legislations in Iowa, Maryland, Virginia, and a number of other states.
Senator, what would you say the definition of Stark law is from just your perspective? Not anything, like I'm not looking for the technical definition. I'm looking from the definition from your understanding of what that means.
Sure. It basically is a physician self-referral. It's United States had set regulations that does not allow doctors from referring Medicare or Medicaid patients to an entity if the physician has a financial interest, right? There's a reason why we don't allow physicians to have a financial interest with a blood lab or other areas. And it's all about, preventing human nature and making sure conflicts of interest don't happen.
It's absolutely right. You put it much more eloquently than I would have. But I just tell people, the lay person who doesn't understand healthcare, doesn't understand why are drug prices so high, and I try to describe PBMs, I'll say that there's a law in the books called a Stark law. And basically that law in concept, from a technical perspective, is being violated by the PBM industry because they own, the insurance company owns pharmacies and then gets to do whatever they want behind the scenes with how they price, what information is being shared that needs to be shared that's considered private or not private, or competitive differentiation, or whatever they want to say is the reason, and then steering patients to pharmacies by pricing a certain way that you have to use this pharmacy, but maybe not say it that way. And then, of course, mail order. So it's like, to me, someone that's watched this, I entered pharmacy in 2004, and I've watched the decline of pharmacies every year after year after year, less and less pharmacies, and more of our 330 million Americans, and we have people that are going through the process of becoming an American, which is even more population, and less pharmacies. And it's like that access to healthcare in your community, it's happening at a pharmacy. And so I applaud you with what you're building, as well as other national transparency acts like the Pharmacy Benefit Manager Transparency Act of 2025 that does exactly what you're saying too, in different components. And it's unfortunate that we can't just have one swath of laws that take care of everything, but it's senators like you that are fighting for your state. It's having a ripple effect on the rest of the nation. So is there another thing that you're wanting to get out to providers listening right now, physicians, pharmacists, pharmacy owners and even hospital systems that are listening right now, knowing that what you're doing in New Jersey will have an impact on this, on your state, but also our nation.
Yeah, no, I appreciate that. I think that our number one understanding is that progress takes time. I mean, we've seen a monumental shift in public opinion where a few years ago you would not see members of Congress speaking out against this. Now we have the Democratic nominee for governor, Congresswoman Mikey Sherrill. It's one of her main platform pieces is regulating PBMs. I don't think we would have seen that 4 or 8 or 12 years ago. I talked about Governor Huckabee, a Republican. I mean, I think the ground is shifting, and sometimes folks are frustrated and they are not patient, but understand that we are taking on some massive corporations, right? CVS, Caremark, Optimum. These are major insurance companies, major players in the market, and this takes time to build that kind of momentum against these guys.
It does. It takes each of the individual states to get involved and to have champions at their state Senate level, educating their own constituents and your own teams, and then taking those wins and spreading it to other states. And as you said, Governor Huckabee and what she was able to do in saying, hey, if you're a PBM, you can't own pharmacies in the state. And right away, we saw the spin coming from CVS Caremark that was saying, oh, we're going to lose access. And what that meant is you don't want to keep your pharmacies open because you're at a certain profit level. And if you go below a certain profit level, you don't want to even be in the game anymore. It had nothing. They can survive. If they expect other pharmacies to survive on those metrics, why can't they keep their pharmacies open? And once again, it comes back to the lopsided profit versus, being in business and caring for your employees, our pharmacists out there, our technicians out there, but then more importantly, the patients in those communities. And we're seeing it in my own community. I lost my pharmacy 6 months ago. Brownsville Family Pharmacy in Brownsville, Pennsylvania. And it's gone because they couldn't stay in business because they didn't have enough support from the PBMs and the insurance companies that were paying or not paying them.
You're spot on, and it's sad what's happening to these independent pharmacies, and that's where people get the most care, especially that senior. That's where you're going to have the independent pharmacy. It's going to take time to educate that senior. We just don't see that in a corporate environment.
Yes. Absolutely. So what do you think about the federal pressures that are mounting? We see more attention coming from, I think our last commander-in-chief in the FTC realm was just phenomenal. And I wish we could have transferred her momentum and her contacts, but nonetheless, the FTC still has teeth that I've never seen it have before. But what else do you think has to happen at the federal level?
I'd like to see the president has been good on what he's saying, but I'd like to see a little bit of action now. And I believe, listen, I give him credit because he's the first U.S. president and someone I obviously, because of being a Democrat, that I strongly disagree with on many worldviews. But on this issue, he's the first president to really take an aggressive position on PBMs. And I'd like to see, one of the skill sets of President Trump is that he is persuasive with his crew and his audience. So I'm hoping that he can really take that in. And I think that both parties have failed really on the interest of protecting the little guy against corporations. And I think that's why many people feel disillusioned with both political parties.
Today's episode is brought to you by PrimeRx. And what's exciting about that is I come from the technology world. And when I started diving into metrics and data around long-term care pharmacy, and we started seeing Medicare Part B, Medicare Part D changing and the structure and the data, it kind of led the way for what is long-term care impact, especially for those people that are at their homes who can't afford to go to a nursing home, and they need to have the same services that are happening at the skilled nursing centers and in the assisted living centers. They need those same services. So part of this whole thing is getting the right data to start tracking how things are reimbursed, what's the consistency, what about this contract versus this contract, so that we have the facts. Going back to what you said, Senator, about transparency, it's so needed. And then how automation can take away some of the nuance efforts of pharmacists so that they're not doing anything that a machine could do, and take their focus and start looking at the diabetic patient and the hypertension patient and the high cholesterol or the obesity patient, and dialing into them specifically. So it's not just a rubber stamp of care, but it's allowing a pharmacist to use their pharmacological understanding about how substances and how blood testing and how pharmacogenomics can change the game for the patient. So if you know that about pharmacists, and you believe in pharmacists, and you were saying how you believe in the independent, what's one practice right out of the gate? If you could wake up tomorrow and you had a power magic wand to put into place, what's that one PBM practice that you'd outlaw immediately?
I think the transparency on pricing. I just tell everybody, and I think that's something that's pretty straightforward. Just show us what you're charging. Give confidence to the consumer that you're not making these record profits at the expense of patients and small business owners. I think that's pretty straightforward.
I like that one.
But they argue that it's proprietary information, that they a part of their business model, which is kind of crazy, because I get that everything's business, but we're talking about life-saving medications for people.
That's true. And some of those pricing schemes aren't proprietary. They don't want it to be known how they're doing a shell game trick from one bunch of money, and where the money's going and how it's being used and ingredients cost. And the world of formulary, it's a mystery. Nobody understands how formularies work except for the PBM that runs the formulary. What gives you hope about reform so far? I know that you shared with me some of the successes of New Jersey already, but what else is giving you hope and seeing reform really take?
I think New Jersey's got a long way to go, unfortunately. We have a hearing going on at this moment in the Senate, which is incredible, to do on this topic of PBMs. But I think New Jersey is behind versus other states. And I'd like to see more folks get louder on this. And I think that that's starting to happen.
Senator, how about encouraging pharmacists and pharmacy owners to reach out to their senators in their own districts to continue momentum, to educate that senator, and to giving that senator support and saying, listen, if you want the education, if you want the data, but what do you say to a pharmacist that's listening right now? How can they help you, help them, help everybody?
Well, I always say politicians are concerned about two things usually. Voters and fundraising. They see a large fundraising number on the other side, they get very nervous, but voters always makes them most nervous. Reach out to your state senator or assembly person. It doesn't help if you don't, like, when I get a message, if you live in my district and you're one of my 220,000 constituents in my 19 towns, I'm going to respond to you immediately, respectfully, because there's only so much time in the day. If you don't live in my district, I'm redirecting you to your senator. So learn the name of your state senator in New Jersey, learn the name of your 2 assembly members, and reach out to them and say, I live in this town. I want to talk to you about this issue. If they or their staff should be getting back to you on this. And if they're not, you should probably vote against that person. But I think this is very straightforward. All politics is local. Get to know the name of your mayor and council. Make sure they understand the importance of PBM reform. I think these are just some very easy things people could do. I wouldn't worry about reaching out to people far away. Change starts at the local level.
So true. That's so true. Well, we are so excited that we got an opportunity to interview you, the 11th district in the great state of New Jersey, in your work in Tinton Falls, New Jersey, and the impact that it's going to have on a national scale. Senator Vin Gopal, thank you so much for being on the show.
Thank you so much for having me.